Hi, I'm Paul Moniz with Albert Einstein College of Medicine. Thanks for joining us. On this segment of Einstein On, we're talking about a free and innovative program offered in the Bronx community for those affected by cancer. This program includes yoga, cooking classes, and most recently even a drum circle. Joining me to discuss this is Dr. Alyson Moadel. She is the director of the Montefiore Einstein Psychosocial Oncology Program. Alyson, thanks so much for being here.
Thank you.
The term psychosocial oncology might be a little bit complex for people. First, can you explain it to us, and then let us know how it is different from other programs that are out there?
Sure. Psychosocial oncology really is a field that focuses on the emotional and social well-being of patients. So while physicians and nurses and healthcare staff focus on the medical outcomes of patients, psychologists and psychiatrists and social workers are interested in how patients are coping with cancer, with the side effects, with the long-term effects, as well as the families.
And you come to this from a very personal perspective. Can you share those experiences that helped shape your career path?
Sure. When I was 7 years old, my mother was diagnosed with breast cancer. She went into remission for about 10 years, and then the cancer came back and it metastasized to her lung. And at that time, my mom and I went to a support group together to deal with, her cancer, and she's a single parent raising me and my brother. So it really affected me. I mean, my mother was dying of cancer, so it was, a couple of years that I lived with her in this end of her life. But just working it out in a support group with other people going through it made such a difference on me that afterwards I went to college and I said, I need to help other people going through this. This is really important. And it obviously directed my career path. And
tell us a little bit more about that career path. What did you do?
I decided I wanted to be a psychologist. I wanted to help other people who were dealing with cancer, and I learned about this field called health psychology. And at that time, it was a very new field. But I found a mentor and just, somebody actually who was a surgeon who was running support groups for cancer survivors, and did an internship there, and then ended up going to college where professors taught me about health psychology, and came back to Einstein and Furkhoff Graduate School of Psychology and got my doctorate there, and did training at Memorial Sloan Kettering Cancer Center, where psycho-oncology really is probably where it started as a research science as well as a clinical field. And have been in the Bronx the last 13 years working and running a psychosocial oncology program. And I love it. I don't think of it as a job. I think of it as something that is a calling.
Let's talk about some of the programs that you offer, because they're so diverse, and for someone living perhaps in Manhattan or in Westchester, they might not seem so surprising, but it's important for our audience to understand that we're serving, in many cases, an underserved population here that wouldn't have access to these programs. So can you give us the range of programs that are offered?
Sure, and I'd just like to add that we do a needs assessment with patients to find out what their interests are first. So our offerings are based on what their interests are. We have everything from yoga classes to fitness classes, nutrition, Reiki healing circles. We even just started a drum circle for patients. We have a weekly crochet group. And we've done other things like jewelry making and music inspiration. And we really just want to give patients a place where they can go connect with each other, find an outlet, and really realize that they're more than their disease. They come back to the cancer center, and it's not just about chemotherapy or radiation therapy, but it's about a drum circle, a Reiki healing circle, connecting with other women and men who are touched by cancer. And the workshops are completely free. They're open to family members as well, and we try to do them in English and Spanish to reach the majority of the population of the Bronx.
And it's important to recognize that while you're focusing on the Bronx, anyone can come. Is that right?
Absolutely. It's open to anybody who can come here, basically, who lives near the Bronx and has an interest and has been touched by cancer, so staff as well.
So let's talk about your newest workshop, a drum circle. First of all, why a drum circle?
Well, for me personally, I have a lot of musicians in my family, and we get together and sometimes play guitar and drums, and it's just very therapeutic. In my own experience, And I just felt that the patients would really respond to it. I mean, we use Caribbean, African, Latin rhythms and drums, and that's, the majority of our populations can relate to it. And I just had this feeling that they would really enjoy it. So I said, let's do it. I did receive a small grant to purchase the instruments. 2 medical students will be running the drum circle. They're drummers in the background. And we launched the first drum circle a few weeks ago, and we had about 12 patients there. And they said they all wanted to come back, and they loved it. So we're going to do it monthly, and we'll see how it grows and how it goes.
That's fantastic. Now, in terms of the other opportunities here, not just for the cancer patients, but for the medical students.
Mm-hmm.
We're a medical school, we're a biomedical research institute, but it's really important for the medical students to see their patients as people and humanize them. I would imagine this program really helps in that regard.
It does. This is kind of a new initiative. I decided, I reached out to experts of all fields to come and share their expertise with the patients. And I thought I'd send out an announcement to the medical students to see if any of them had any expertise in other things besides medicine or interest in medicine. And there was a dance instructor and these 2 drummers, and they were interested in contributing their skills and talents to the patient workshops. And I'm very excited about it, and I do agree with you. I think that it'll help give them the human perspective of what patients go through and give them an appreciation for other forms of healing and care in medical care when it comes to cancer. So I think it'll help balance them, hopefully.
Now, before we talk about some of the other workshops in detail in terms of the offerings, I really want to turn the focus over to your research.
Sure.
You have your doctorate, and you've done research to show that this isn't just time out, so to speak, that these programs actually have an impact on someone's psyche, on someone's potential progression and continuation, perhaps into remission. Can you talk about the research studies that you've done and what the outcomes have been?
Sure. My major research study has been looking at mind-body therapies like yoga on the quality of life of cancer patients, particularly breast, lung, and colorectal. And I have a study that's been going on for 10 years where we have 3 yoga classes going on a week. And it's a randomized waitlist control study. So patients all get yoga, but they either get it right away or they wait 12 weeks and then they get it. And we evaluate their quality of life, which is their physical, emotional, spiritual well-being, as well as areas of pain, fatigue, and other issues. And what we found so far is that patients actually do have an advantage in their quality of life if they're in the intervention group, if they're taking yoga for 12 weeks. They do have improved and protected quality of life.
How does that manifest itself specifically?
Well, in terms of the self-report standardized questionnaires we use, we find that their mood is better. They have less distress because coming into the study, oftentimes they have very elevated anxiety, depression, anger. And as they go through the yoga program, they're much more calm, they're less distressed. They have a stronger sense of spiritual well-being. And an overall kind of physical well-being. I mean, some of them are still grappling with physical issues, and yoga doesn't necessarily cure everything, but it certainly helps them cope better as they go through the experience of cancer and treatment and post-treatment recovery. So it's been, so far, it's been showing some positive results.
We should bring up that this is really an integrated approach. So we're not suggesting here that someone doesn't go through chemotherapy or radiation therapy. What we're suggesting here is that you can really do both.
Absolutely.
And you should do both.
Absolutely. This is complementary, not alternative medicine. It's or integrative medicine, as you said. We never tell patients take yoga instead of chemo or radiation. It's really to help them get through those treatments and to cope better with the stresses that they experience. And so it's a complementary medicine approach.
The Reiki healing that you've recently started, tell us how patients have reacted to that. And first off, for those who are listening that might not understand Reiki, can you explain exactly what happens during one of these sessions?
Sure. Reiki healing is led by a Reiki master. It's a Japanese healing art. It's usually gentle, hands-on healing. And patients usually come, they sit in a circle. Sometimes they hold hands, not always. And somebody who is a trained Reiki healer will come around and touch them on their heads or on their shoulders or a place that has pain or discomfort. And they also read some spiritual cards. They call it angelic healing cards. And I think our patients really respond to it, and we get a very good following in terms of our Reiki healing circles, because our patients tend to be very faith-going, very spiritually oriented. I did a needs assessment, a spiritual needs assessment of our patients, and one of the things they said is they wanted more spiritual resources in their cancer care. And I think this meets that need. They're very interested. It's complementary to their belief system, and that group is very well attended and very positively rated.
Now, in terms of the other individual needs that people may have, you also are involved in a mind-body support group program, and you've mentioned earlier in our interview that the supportive environment is critical for a lot of these patients to really feel like they have a community, that they're beyond their disease, so to speak. They're not defined by it. You have a program that's being funded by the American Cancer Society at the moment. Can you tell us about that?
Sure. The MindBody support group is really a spiritual support group. It's helping patients connect to something greater than themselves, so that they don't have to be religious, although many of them are. And it's non-denominational, but it's really helping them to know that they're more than their disease, that they're not alone, and that they can turn to something greater than themselves to cope. And whether that's religion, nature, humanity, a purpose, the group, it doesn't matter. They can choose what it is. And it's mainly for advanced stage disease. So patients there who are grappling with the more difficult issues with cancer come and really they get a lot out of it. They're very connected with each other. And the facilitators, one is a cancer survivor herself, and one is a psychology intern, and they're very well connected, and it's been going on for 4 or 5 years now.
So in that time, what have you found in terms of results? Are there some consistent patterns that you're seeing?
Well, we haven't finished analyzing the data. One of the issues is when you're working with advanced stage disease is that it's very difficult to get patients to come to groups because they are sicker. And there's been challenges with keeping, the attendance up. So I think one of the things that we learned is that we need to find novel, more accessible ways to bring these groups to patients or these services. So we're working on how to do that. But in terms of the patient's responsiveness, they love the group, they love the connection, they love the fact that those emotional and spiritual needs are being met. And it's not one size fits all. This particular study began as a comparison group. So we had a spiritual group versus a stress management group. And we found that it's not one size fits all. That I thought everybody would want the spiritual group, not necessarily. Some patients do, and some patients want a more stress management oriented group. And I think we're learning what patients want and not deciding, well, we're going to put you in group A or group B randomly. So it's a little bit of a unique design because it's called a patient preference trial, allowing patients to choose. So we're in the midst of kind of seeing, does it help them when they get a choice of group? Does it improve their quality of life, their retention in the group? And we are finding it does so far. They're coming more often.
Alyson, you've been doing this for a decade and you come to it with such a personal perspective. What is the ultimate goal of your professional programs?
I would say the ultimate goal is really to give patients a place where they can go and find support, connection, understanding, and to find themselves beyond the cancer. So really where they can cope and connect and learn ways to participate in their care, to heal themselves. And I don't mean heal in terms of cure, but to feel that they're doing something to help themselves recover. So empower the patients. My ultimate goal is to start a wellness center that we can have in the community so patients don't have to go to the medical site where they've had their chemotherapy and the radiation and get the yoga classes, but they can go somewhere that's sort of neutral and nurturing and have a yoga class there. So that would be my ultimate goal.
You mentioned something earlier that I want to go back to, which is that you do deal in some cases with patients who are terminal. How does this program fit into that, and how does this program help patients make peace with the fact that they're going to die?
Well, I have 6 psychology interns that provide counseling, one-on-one counseling to cancer patients in English and Spanish. I supervise them, and we work on the patient's level. I mean, we help them, write letters to their children if they're dying. We help them leave a legacy, whatever that might be for those people that they might be leaving behind. We help them cope with saying goodbye and finding meaning in their lives and in their deaths. And with every patient, it's individual. Some people grow from having a challenge, like their mortality, and some people may not grow, but we help them deal with the anxiety and the depression, and but they're not alone, and that's the most important. They have somewhere to talk about it, to connect with somebody, and to have somebody bear witness to their own pain and suffering.
Well, with these kinds of resources, we want to make sure that people know how to access them. So what number should they call if they're interested in learning more about the program? Can you give us a phone number and an email?
Sure. The phone number is 718-430-2200, 2200, and the email is cancersupport@einstein.yu.edu.
Okay, and we're putting it up on the screen here for people to see as well.
Great.
So really hope that more people will take part in this really important program that you're working with. Alyson, thanks a lot. You're doing fantastic work. We certainly wish you the best of luck and appreciate your time and speaking with us. We've been talking with Dr. Alyson Moadel, Director of the Montefiore Einstein Psychosocial Oncology Program. I'm Paul Moniz. Thanks a lot for joining us on Einstein on Cancer, and we encourage you to visit our website at einstein.yu.edu for more science and medical news.